Dying for a Chat provides the concise yet comprehensive information on the highly prevalent issue of ineffective communication in healthcare system. The book is a winner of 2013 Human Rights Literature Award and is written by an oncologist and renowned author Dr. Ranjana Srivastava, practicing in Melbourne Public Hospital. Other books written by Dr. Ranjana Srivastava include A Cancer Companion and Tell Me the Truth. The author, by using her vast experience of working in a healthcare system, has made an attempt to draw the attention on the imperative but consistently overlooked issue of ineffective communication that not only undermines the well-being of the patient but also contributes to the issues facing Australian healthcare system. Thus, the book accentuates the need to address the communication gap, to utilize the advancements in medical science in the best possible manner to achieve better outcomes and to ensure the sustainability of health services. The author has centered the text on a 90-year-old female, Mrs. Johnson, to discuss multiple issues in healthcare system impacting the quality as well as the outcome of treatment provided to the patients. The author has very nicely explained the lack of communication skills in medical professionals by thoroughly describing the avoidable sufferings Mrs. Johnson underwent due to multiple communication errors. To start with, poor communication between different specialists leads to Mrs. Johnson's renal failure. Although the author was aware of the probability of worsening of Mrs. condition right from the beginning, but no one had the time to discuss this important matter with her, and the matter seemed trivial as she was showing the signs of recovery. Even on worsening of her symptoms, everyone, including the author, chose the easy way out by avoiding the discussion about the end-of-life care with the patient or her daughters. Furthermore, options were presented to her daughters as the ray of hope, but the discomfort associated with the procedures and the inevitable outcome were omitted from the discussion, leading to the futile decision making by daughters on the behalf of their mother, adding further sufferings to her. The author has argued communication issues result from lack of training and experience in such situations. Wu et al. Has documented that clinicians treating patients at the end of life usually lack adequate training to help them in making end-of-life decisions and to inform about the undesirable outcomes. A survey conducted by Sullivan et al. Showed that only 18% of medical students and residents received formal training in end-of-life care, and over 40% of residents felt unprepared to teach end-of-life care to younger clinicians. The author has also highlighted the issue that most often doctors believe that they have provided clear and enough information, but patients feel otherwise. Studies on doctor-patient communication have shown dissatisfaction among patients even when doctors consider the communication was sufficient or even excellent. Tung et al. Have reported that while 75% of the surgeons were satisfied for their communication with the patient, only 21% of their patients were satisfied with the communication. The author has also touched upon the issue that diagnostic aids are being used more often to establish a diagnosis rather than detailed conversation with the patient about their symptoms. Yan et al. Has reported that physicians favor the use of available aids and rely on the contemporary trends to manage an illness rather than discussing symptoms with the patient. The author has also highlighted the issue that the higher remuneration of specialists and the misperception that specialists represent greater achievement lead to increasing number of specialists. The specialization in a particular field results in fragmented approach. Due to lack of financial incentives, general practice has become a site of quick fix as patients suffering from multiple diseases get referred to multiple specialists. Each specialist looks narrowly at a particular aspect but critically lacks overall picture. This results in negative impact on the well-being of the patient. Mrs. Johnson's death illustrates this issue as she died due to renal failure caused by adverse interactions between drugs prescribed by different specialists without knowing the treatment provided by other specialists. Moreover, the specialist consultation increases the chances of expensive procedures and interventions to be conducted, which can be futile at times and even adversely impact the patient's health. The author has given an example of how a futile CT scan ordered by a lung specialist to find a more specific cause of dyspnea due to exertion in a obese but otherwise healthy patient commenced a series of miserable events ending in a transition of patient in nursing home. Similarly, a futile MRI triggered a series of events resulting in passing away of a confused patient. The author, by citing the Dartmouth Atlas study, has also documented that patients who receive more intensive care do not necessarily suffer from complex or severe illness, do not necessarily receive evidence-based care, or do not necessarily have a better outcome of the treatment. In line with author's arguments, Stange has highlighted the ineffectiveness of technologically advanced US healthcare system due to fragmentation. Stage has also highlighted that increasing specialization also impacts on the goods made by manufacturers, as they are more inclined to make highly profitable goods rather than those which yields less benefits, thus increasing the inequality in healthcare services. Lee has also documented that fragmentation, along with lack of communication and coordination between teams of specialists, raises the concerns about the patient's safety. By being skeptic about Mrs. Johnson's admission to the ICU, the author has raised the issue of suboptimal implementation of evidence-based best practice guidelines while treating the patients. Such an approach may result from legal obligations or due to financial incentives, as denying intensive care to a dying patient can invite a lawsuit, or rejecting to prescribe antibiotics to a patient with viral sinusitis may result in patient seeking treatment from another physician. The core issue playing part in this problem is patients' linear understanding of the medical services or treatment. For them, sickest people go to the intensive care because it is the place that fixes them, and antibiotics are given to the patient to treat the infections. Abundance of dubious information on the internet influences the patient's perception about health and persuades them to seek specialist consultation or demand for an expensive but futile treatment processes. Thus, the author has recommended implementing patient-centered care, including support for enabling the patient to understand different outcomes for different people. Sustainability of the healthcare system is another issue raised by the author. The author, while describing most of the above-mentioned issues, including specialization or over-investigation, medication use of futile importance, legal obligations, and ineffective communication, has explained how they exert extra pressure on the healthcare due to wastage of resources, including time and money. The author has shown her concerns about aging population, and by citing Australian Institute of Health and Welfare, she has documented that aging population will face a glut of complex and chronic diseases in next 20 years. Thus, to ensure the sustainability of service system, urgent measures are needed to be employed to prevent over usage of healthcare system. Coming to the recommendations by the author, in the end, author emphasizes on the need to understand that poor communication between doctors and patient is one of the primary driver of dissatisfaction with healthcare. Dr. Shrivastava has emphasized that best medicine should begin with chat, and to obtain this, she has recommended formal training of health professionals. By giving the example of Boxbaum Institute of Clinical Excellence and New York's Memorial Sloan Kettering Cancer Center, the author has advocated to train clinicians for becoming navigators, advisors, and counselors to facilitate patients in making difficult but best decisions. She has also recommended the use of feedbacks from patients on different styles of communication to train doctors on the way to share the information in the best possible manner. The author, by citing Schwartz's central rounds, has also acknowledged the importance of relieving the stress and isolation of the role among health professionals in improving their ability to communicate effectively. The author has also advocated the use of checklists for health professionals to help them consider the right time and place for conversation with patients and their family members, to be compassionate, to share information properly, and to invite or entertain the queries of the patients. Thus, Dying for a Chat expounds on how objectively efficient healthcare system is failing on subjective grounds. Ineffective communication is leading to mortality of the patients, dissatisfaction in the community, disheartening of the doctors, and disapproval among bureaucrats. Though training health professionals on communication techniques seems trivial, but it has the potential to improve the doctor-patient relationship and the involvement of both in shared decision-making. By reviewing this book from the lens of public health practitioner, I would agree that with the author that the health system is more focused on preventing the inevitable death than improving the quality of life. Terminally ill patients do not want to live longer, they just want to die in comfort. Their relatives would like to be aware of the possible outcome beforehand rather than being surprised. The strategies to strengthen the patient relationship, and to make the communication more effective, as suggested by the author, are seemingly by far the best possible solutions to address the discussed issues. But I wonder how much role does the increasing social isolation plays in the misery of end of life period. Does spending more time with loved ones will help to understand in a better way what they would actually want in the end stages of their life, and facilitate the decision making rather than a third person which may have been known to them for few years or days, describing the available options. Thank you.